Good morning. It's Thursday, July 30th, 2020. My name is Joe Doherty. I'm the Communications Director for the Utah Department of Public Safety and Unified Command for the state's COVID-19 response. Today is our weekly briefing. We have a number of speakers. I'll briefly introduce them to you. And as a reminder, during the Q&A portion of this press conference, all question askers will be chosen at random. And that is the typical process that we have followed through these briefings. First, we will hear from Dr. Angela Dunn, the state epidemiologist from the Utah Department of Health. She'll be followed by Governor Herbert, and he will be followed also by Dr. Ben Abbott from Brigham Young University. We will also have Sydnee Dickson, the Superintendent of Instruction, coming up a little later. So thank you, Dr. Dunn.
Okay, good morning. We have 39,696 cases of COVID-19 identified in Utah. That is an increase of 502 from yesterday. But more importantly, our 7-day rolling average is at 508 new cases per day. We've tested nearly 525,000 Utahns for COVID-19. That's unique individuals. So approximately 1 in 6 Utahns have been tested for COVID-19. And our 7-day percent positivity rolling average is 9.6%. We do have 9 new deaths to report today, for a total of 300 deaths due to COVID-19 in Utah. That's a net increase of 8 because 1 individual death was removed and is being investigated further for the exact cause of death. We have gone from a plateau to a decrease in total cases in Utah. That is statewide. And with school starting soon, it is really important that we continue on this trajectory. We have the opportunity to start school with case counts decreasing and being more in control. And to do this, we need everybody to continue wearing face masks in public, practicing physical distancing, staying home when you're ill, and using good hand hygiene. If we all do these things, we will continue to see a decrease in cases and start school as safely as possible. Now, Governor Herbert.
Thank you. Well, thank you, Dr. Dunn, and again, welcome to everybody for our weekly briefing here. I think most people know this has been a pretty challenging time for not just the state of Utah, but for the country and many other states and certainly around the world with this pandemic. And we certainly have tried here in Utah to give accurate information, have a place where you can come to and trust that you're getting the truth, the facts, as we understand them today. This has been an evolutionary process. We are learning as we go, and we still will learn. Wherever we're at today, I'm sure we might have some modifications tomorrow as we learn more about this pandemic and about COVID-19. We've tried to bring together our best thinking, people from science, from medicine, the business community, really having everybody and all stakeholders around the table as we've tried to find ways to protect people's lives, their health and welfare, and that includes their livelihoods and making sure that the economy continues to function also. It really has been, as I've said many times, a balancing act, and I think overall we've done a pretty good job of balancing it appropriately. Certainly has not been perfect. We are certainly imperfect, but we are doing the best that we can. I hope we appreciate the fact that we have people in what we call our unified command, which meet every day to review the data. And as we devise policy based on what the data informs us, we end up trying to analyze a lot of different metrics. You hear about the case counts. That's certainly one metric that we have here. The rolling 7-day average which I think gives us a better view of what's taking place over a period of time and what the potential trends may be or are. The transmission rates, which we don't talk about too much, which I think are extremely important. Our hospitalization, utilization of our hospital beds, and particularly the utilization of ICU beds. Those are all part of the story. And as we track these many different metrics, that helps us to be informed as far as what we should do. You, the public, can make sure you can access this information too, not just on the newspaper or television as you get the reports, but you can go to coronavirus.utah.gov, where you'll find significant detail and explanation to these data and these facts and statistics. Dr. Dunn has been really a very steady voice that I think people have appreciated throughout the state to not only just give us information, but also give us the context of what it's found. And so I appreciate her report that she's given today. And in that same vein, today I'd like to ask Dr. Dunn to come back out. What I've noticed is we've had a number of questions that keep coming up. And I'm not sure that we've answered the questions as diligently as maybe we need to do. We say it once and maybe only a few people hear it. But there's a number of questions I have here that I would like to ask Dr. Dunn, kind of under the heading of let's make sure that there's an understanding of what's taking place, what the truth is, that separate fact from fiction, and give us better context as far as where we're at. So Dr. Dunn, if you'll come forward here, I'll stand to the side and I'll ask you some questions. We'll slide back and forth. The first question I hear all the time is, Governor, this is really no different than the flu. It's the same thing. It's an overreaction the government is making and others in regards to COVID-19. So the question, Dr. Dunn, is what is the difference or the similarities between our traditional flu, and we have a flu season coming up, and the COVID-19 pandemic?
Yeah, so we know that COVID-19 is certainly more infectious and more deadly than the annual flu. Already to date, we've had twice as many hospitalizations and 5 times as many deaths due to COVID-19 compared to last year's flu season. There's also some key differences, right? Flu, we have a vaccine and we have known treatment with antivirals, and we don't have that information yet for COVID-19. There's just so much we don't know about the virus that causes COVID-19 that makes it more dangerous and unpredictable moving forward. So it's really important that we do everything we can to protect ourselves against flu moving forward, because we are going to enter flu season, and make sure we all get our flu shots so that we can continue to stay safe from all respiratory viruses and protect our healthcare capacity. So moving forward, we just know a lot more about flu. We've got a vaccine and we have treatment. And already COVID-19 has caused more hospitalizations and deaths this year alone.
Let me just follow up on that, Dr. Dunn. The concern I think many people have is the impact of the flu on us, or COVID-19, both, I guess. You mentioned it's more infectious, it's more deadly. I hear different reports. I see the mortality rate in Utah is at 0.7, less than 1%. Nationally, it's 3.5%. That's 35 times more deadly around the country than it is here in Utah. Talk to that issue compared to flu, which I've heard is 1/10 of 1%. Those that contract it die. We do have some advantages with a vaccine, which we don't have with COVID-19. But tell me exactly, and tell the public, how much more deadly is the COVID-19 than is the flu?
Yeah, so because COVID-19 is something, we just identified in December of 2019, it's going to take the scientific community time to understand exactly how much more deadly it is than flu, because it's only been around for a few months. And so as this pandemic evolves and we get more information, we'll be able to more accurately say how deadly COVID-19 is. I think something to anchor to, though, is knowing that already in 5 months of COVID-19 in Utah, we've had 5 times as many deaths due to COVID-19 compared to flu season last year, which is an 8-month season. So it has already claimed more lives than flu.
We've talked about case counts. That's been a topic, and we see that as kind of a headline on the news every day about how many the case count numbers are. I'd like you to tell me what you believe is the most important data. Case counts may be one, but is there other things? What's the most important data that the state uses for making our decisions, and what should the public use? What should they be listening for that's available to them online, or what they say here in our press conferences? What's the most important data points?
Sure. So from a public health response perspective, we look at our data to identify which populations are carrying the biggest burden of COVID-19 and what interventions would most help those populations. So we're looking at infectiousness, death toll, but also access to testing to make sure that we have as much prevention measures in place as we can to protect those at highest risk for severe disease due to COVID-19. On an individual basis, definitely the information on the coronavirus.utah.gov website is really important for you to understand kind of how the spread is going in Utah and the impact that our own individual actions can have. I mean, we know that since individuals have started wearing face coverings, for example, more in the past month, we've seen a drastic decrease in cases. So we know that the individual actions we all take can help populations as a whole be healthier throughout this pandemic.
Again, along that same vein, we hear about case numbers, we hear about infection rates, we hear about transmission rates. Can you explain the difference between those three?
So the case numbers that we report from a health department on a daily basis are just the actual numbers of individuals getting infected. We also look at rates by geographic area so that it takes into account the underlying population. So the denominator of Salt Lake County, for example, compared to Iron County. Very different populations, and it allows us to understand if those populations were the same, is the infection rate the same, so that we can identify the true burden of disease. And then we also talk about transmission rate, and that's how likely one individual who's sick with COVID-19 is to infect another individual. And the measures that decrease that transmission rate before we have a vaccine are going to include wearing a face covering, staying home when you're ill, and practicing physical distancing. And right now our transmission rate in Utah is estimated to be below 1. So that means that every individual who has COVID-19 is spreading it to less than one other individual, and that's contributing to our decline in cases.
I follow the transmission rate. I think that's really a key issue for us, and to find that we're down below 1 now is good news. That means our numbers will continue to slow down. Another question I get all the time is, how do we in fact determine whether somebody dies from COVID-19? And there's confusion about there's confusion I've heard in different areas of, well, hospitals are inclined to make it a COVID-19 death, even if it's marginal, because they get paid more money if it's a COVID-19 death. So how do we in fact determine if somebody died based on a COVID-19 infection?
So we at the health department are notified of every individual who has COVID-19 and then passes away. We work with the clinicians and our medical examiner to determine the cause of death. So just because someone has COVID-19 when they pass away does not mean that they will be counted as a death due to COVID-19. We actually investigate those cases to make sure that the cause of death is related to COVID-19, so that if that individual had not had COVID-19, they would not have passed away. So all of our deaths are specifically due to COVID-19, and I'm very confident that we're capturing the deaths accurately.
We've heard a lot of talk about mask wearing, and certainly in Salt Lake County, they've touted the fact that their rates have gone down, their case numbers have gone down because of the use of the mask. The question is, people ask, is it really the Salt Lake County has gone down, or they just plateaued, and has the rest of the state increased so that it looks like Salt Lake County has a smaller percentage, even though they're a third of the population? We know that they have a higher than about 57% death rate And so how do those juxtapose? And is Salt Lake County getting better, or is the rest of the state just getting worse?
That's a really good point. We know that Salt Lake County is seeing a true decrease in cases. Ever since, about 2 weeks after the mask mandate went into place, we've seen a really sharp decline, and that's also contributing to our overall statewide decline in cases. For most of the pandemic, Salt Lake County had contributed to over 50% of our cases statewide, and now they're at about 40 to 45% of our cases statewide. So they are dropping quicker than our surrounding jurisdictions across the state. However, the good news is that right now, all of our jurisdictions are seeing a decrease. So we're going in the right direction statewide, but Salt Lake County specifically is carrying a lot of that burden in terms of decreasing really quickly and allowing us to see the trend go lower statewide as well.
Thank you. I have two more questions. We have on our webpage an information that comes out that says that 68% of the people who've contracted COVID-19 have recovered. And so we have people think, well, we're only getting about 2/3 of the people recovering from the virus, and yet our mortality rate is at 0.7. Can you explain what the truth is about the recovery rate of the people of Utah going through this process now these last 5 months?
So recovery rate is something that's not well understood across the world in relationship to this pandemic. So we are using a very crude definition of if you've been identified with COVID-19 and you haven't passed away within 3 weeks, we're considering that recovered, and we recognize that that's not true recovery. We know now that individuals, even if you haven't been hospitalized, can take several weeks to a month to actually fully recover, and we're learning more and more about the long-term effects of COVID-19. So recovery is one way that we are tracking people who are potentially still infectious and still out there in the community with COVID-19, recognizing that there are a lot of limitations to that number. Of course, as we're progressing through this pandemic, we have more cases, coming in over the past weeks and months than we did at the beginning of the pandemic. And so our recovery rate will lag as well, because we have more individuals being diagnosed every day with COVID-19, and it has to be 3 weeks before they're considered recovered by our metric right now.
I guess, Dr. Dunn, it depends a little bit on how we define recovery. If recovery is defined as you didn't die, then 99% of the people that get it are recovering in Utah. But we also know that there are some residual impacts and some concerns we don't have. We have some uncertainties. What are some of those uncertainties that people are looking at with the contract COVID-19 in a longer term period?
Yeah, again, this is something that we are looking at nationally, and scientists are trying to figure out worldwide, what does that long-term effect of COVID-19 look like? We only have a few months here in Utah to really try to understand that. And we know that there are some individuals that have problems breathing and engaging in exercise and activity that they engaged in prior to COVID-19 for some weeks after having the illness. So that is an evolving aspect of this pandemic, and something that we're all trying to really understand completely, so we can identify who's actually recovered.
Thank you. And the last question is one that we've started in the very beginning. We've talked about the importance of what we do as a community, as a state, to make sure we don't overwhelm the medical system, the healthcare system. And so talk to us about hospitalization availability, rooms that are available. I know we have about 4,200 hospital rooms in the state of Utah. How many are being utilized? ICU beds. What are we doing? Are we in danger of overwhelming the healthcare system, the hospitalization? Help us understand that a little better.
Yeah, so we work very closely with all of our healthcare systems to identify their capacity to take care of COVID and non-COVID patients. And that's something that we really need to have our finger on the pulse of as we enter flu season, knowing that we will have more individuals being hospitalized due to flu on top of COVID. So currently we look at number of hospital beds available, so non-ICU and ICU beds, and we look at COVID patients and non-COVID patients taking up those beds. For hospitalizations overall, so non-ICU beds, we have robust capacity there. We haven't really gotten near overwhelming our general hospital beds. It's the ICU beds that are, more limited capacity. We have, somewhere around between 500 and 600 ICU beds available in the state of Utah, and we look at, are they adequately staffed? Can they provide high level of care for COVID patients? And that's something that we really need to protect moving forward as we move into especially flu season. So that's why it's so important that everybody get their flu vaccine when it becomes available in September.
Thank you, Dr. Dunn. We appreciate those frequently asked questions and your answers. Help us understand better. Don't go away. We'll have probably some Q&A here a little later too. We might have some more questions for you. I think, again, as we just kind of rehearse here, that my concern really is not only the deadliness and the infectious rate of this COVID-19, but the potential long-term residual impacts where it hurts people's lungs, a sense of smell and taste as a long time coming back. There's fear that some will never get it back. So we're learning about the long-term impacts, which are somewhat unknown, but ought to cause us concern. This is not like the typical flu. It's worse than the flu. We know the best way to prevent the spread of the COVID virus. This is not new. I know we sound like a broken record, but until everybody does this, I guess we'll keep mentioning it. And that is to make sure that we, in fact, practice social distancing, which is defined as 6 feet from one another. If you can't social distance, then you should be wearing a face covering, a mask. We'll hear more about that a little bit later from our BYU folks. You certainly should stay home when you're sick. That's kind of a no-duh moment. But too often in times past, we've pushed ourselves and gone to work even though we're not feeling well. We have to be extra careful today because of the COVID-19. So don't go to work when you're sick. And last but not least, you should, in fact, wash your hands frequently. If we combine all those together, we have a good chance of reducing and slowing, as we see happening now. Let's make sure we continue. In fact, if anything, we have to redouble our efforts to make sure that we do that. I'll just conclude that part by saying, we've done the analysis for your information. 76.4% of the people of Utah who have died from COVID have had at least one underlying health condition. Now, I would just suggest to all of us that we have a moral obligation, all of us, whether we have underlying conditions or not, to in fact show the respect for our neighbors that we ought to by in fact practicing appropriate protocols, including wearing a mask. As Utahns, I think that moral responsibility behooves all of us to do our best that we can. I've been surprised at why wearing a mask has become kind of a political issue. It shouldn't be political at all. It's really good science. It's good sense. And it does help us protect ourselves as well as our neighbors from having access or getting the coronavirus and infecting themselves for whatever impact it will have. And of course, we know that it impacts people differently. We don't know. We've seen young, healthy people get impacted and have a tough time. We've had old people have recovered. But the statistics show us that it's the vulnerable populations, elderly, and those that have underlying conditions that are most impacted. So let's all do our part as good citizens of this great state to help slow the spread of this coronavirus and protect our neighbors. With that in mind, we have with us Dr. Benjamin Abbott, who his colleagues have been working at Brigham Young University to actually review the science of mask wearing. There have been, misstatements and contrary opinions about this, certainly in the early stages. I don't think we have that today. Dr. Abbott can talk about that, but I've asked him to come and speak to us about his study and the information from mask wearing that they've done at BYU. So Dr. Abbott, if you'd come forward.
Thank you, Governor, for the opportunity to share this important research. This research that I'm presenting today is based on over 130 scientific studies associated with COVID-19 and the effectiveness of masks. And it wouldn't have been possible without the volunteer work of members of my lab team. So please take a look at the study itself. It has all of the information and names there. We didn't receive any funding to do this work, nor do we plan on pursuing funding. This was a review that we did because we were concerned citizens and people with scientific training. We felt a responsibility to address the widespread confusion and sometimes misinformation that we saw circulating online and among our family and friends. We didn't have an agenda going into the research. We weren't sure what the answer would be. But again, don't take our word for it. Look at the report itself and look at the studies it's based on. I organized my comments around a few different questions. First of all, why is there so much confusion about masking? As the governor mentioned, initially we knew very little about this disease, and the recommendations that came out of the CDC and the World Health Organization were based on old research on other outbreaks. So based on that previous research, they recommended that masks would not be effective, public masking would not be effective. However, since it's a rapidly evolving situation, only months after the beginning of the outbreak, studies started coming out that showed a very different picture. And after those studies became available, those recommendations followed suit. That's how the scientific process is supposed to work. You make a conclusion based on the available evidence, and when new evidence becomes available, you change that conclusion. So this fundamental question, are masks effective at preventing COVID-19? It is now abundantly clear that masks are an essential tool at slowing the spread of COVID-19. One of the first clues that masks were effective came from the difference in the rate of spread and the mortality among different countries. So here I have a figure that shows the relationship between how early masking was implemented, and on the left side of the screen, the rate of transmission, and on the right side of the screen, the rate of mortality of this disease. And actually, this data has now been updated. It's a few weeks old, and in COVID terms, that's a long time. The relationships are even stronger now. But what you can see on either side is that countries that either had a mask culture to begin with, so many countries in Southeast Asia, for example, have long used masks to prevent spread of disease. They had much lower transmission rates and substantially lower mortality rates. That second number is very important, because it indicates that when masks are used, the disease is actually less deadly, even if you catch it. Now, the mechanism behind that is not yet known. It's possible that the amount of viral load that you get initially, if you breathe in a lot of the disease, it's more likely to be severe. If you only get a small dose, it might be less. Again, we don't know the reason, but this is very robust, that when masks are used, the mortality rate goes down. Now, if you could go to the next slide. The first one was a comparative study, and there's some issues there in establishing the cause, what's making those differences. So now we know from many states that have implemented masks, and this example comes from Massachusetts, where their healthcare system was having a rapid COVID-19 outbreak. It was exponentially growing. That's the pink part of the graph on the left. Universal masking was implemented in their healthcare system, so over 75,000 people were involved in this study. The rate very rapidly stabilized, and then the yellow part of the graph and green part of the graph is where universal masking was implemented also in patients, including those showing no symptoms. So here we see a longitudinal example that has now been repeated and observed in many states in many different contexts. So the evidence was starting to build why masks were effective. But if you go to the next slide, there's another line of evidence that's been that has recently come out showing us why masks work. So on the left-hand side, this is an image made with lasers shooting in front of someone's face. When someone is speaking, many tiny droplets are ejected out of their mouth, and the breath of air that comes from their mouth and nose can carry those several feet away from them. Wearing a cloth mask on the right, about 90% of those droplets are contained within the mask. So this is what's called source control in public health. My mask protects you, your mask protects me. That's all I've got as far as figures right now. But I want to address why are masks effective against this disease when it didn't look like they were against others. And Dr. Dunn laid this out very, very well. First of all, COVID-19 is extremely contagious. Those droplets can linger in the air, they can land on surfaces, and the virus can remain viable for minutes or up to hours. So long after someone exits a room, if they have the virus, those particles can remain. So keeping those droplets within the mask is really crucial. The second reason, which in my opinion is more important, is the rate of asymptomatic spread of this disease. So it's estimated that 50% or more of the new cases of COVID-19 are spread by people who are showing no symptoms. So I could be feeling completely healthy, and yet I still have the virus reproducing in my system. I could spread it to my loved ones, my neighbors, and strangers that I meet. So that's why preventatively wearing a mask appears to be so effective at combating this disease. Now, there was a lot of concern before and after we published this study about whether masks were safe. We had seen on social media claims that masks would reduce your oxygen level or increase your CO2 level. So we looked at all of the studies that had been cited by people making those claims and also did an exhaustive search of the literature. The conclusion was unanimous. Masks are completely safe for healthy individuals. This was a personal concern to me. I have 4 children who will be going back to school in the fall. I wanted to make sure that what I was asking them to do was safe, wasn't going to hurt their development. Masks in many laboratory studies have been shown to be safe. Doctors have used them for centuries. And the most convincing evidence comes from these countries that have long used masks, where young people, adults, and the elderly have safely worn masks with no side effects. Masks can cause skin irritation and foggy glasses, as many of us have discovered. And then there are certain individuals, if you have a severely compromised respiratory system, or if you can't remove and adjust the mask yourself because of severe disability or a child under 2. Those are the only classes of people that can't safely wear a mask. So the last question that I have is, will masks solve COVID-19? And researchers from hospitals, academia, universities, agencies, and the private sector have all come to the same conclusion based on this overwhelming evidence that masks are a very powerful tool that can reduce the spread of COVID-19, and when used in combination with other measures could really get this outbreak under control. But that's the final point that I want to make. Masks are not a silver bullet. And the one medical concern that there has been about masks is they can give you a false sense of security. So if you put on your mask and then go about your day as if there wasn't a pandemic, your mask is not going to protect you. So masks only are proven to work when used in combination with social distancing, frequent and thorough hand washing, self-quarantining if you've been exposed to the disease. But when those are used together, there is broad agreement and scientific unanimity that this could be our bridge back to normal, could have huge economic payoffs, and could get this outbreak under control.
Thank you, Dr. Abbott. We appreciate your work of you and your colleagues in helping us to understand better the positive impact of wearing face coverings. Our last topic for today is something that I know we have a lot of interest in, and that's the opening up of our school system. It's that time of year, back to school, sales are going on, and we're trying to plan for that to happen here in just a few weeks. Yesterday, I had the opportunity to spend some time with folks involved with our education system, also legislative leaders, both the majority and the minority parts of the aisle, We heard a lot of candid opinions from Utah Education Association reflecting teachers and their positions and concerns. We heard from local and state school boards, or from superintendents. Again, all of them working together to try to find out how to do things. Everyone wants to open up the school system. Everybody wants to go back to what we used to call normal. But the question is how? How do we do that today with the pandemic going on? And we have a number of different programs that are being proposed by our local school districts. We have 41 school districts. I expect they'll not all be the same. They'll have their own way of doing it. Some will have delayed openings, some will have hybrid openings, some will do more distance learning. Depending on the situation they find themselves in, I trust the local school board and the local superintendents, school board elected by their constituency in that region, to make the decisions in the best interest of the people in that region and their students. And they're working very diligently to do that. Clearly, the goal for all of us is to find a way to open up our school system, educate our students, our young people, and give them an opportunity to learn and develop skills that they'll help them be effective members of society. But we want to do it in an environment that is safe for them to attend, that parents feel good about sending their children off to school, and that the teachers also feel good about going to school, and those teachers and faculty members, and all the way from the bus driver to the janitor, feel like this is an environment where we have at least minimized the risk. We know we can never eliminate all risk, but we certainly can control the risk, and that's part of the discussion, the debate. So with that, I'm going to call Dr. Angela Dunn back. She's been working very closely with the schools to help standardize some areas that would be appropriate for schools to adhere to as we go back to school. And so I'll ask her to come and maybe give us some information in that regard. Dr. Dunn?
Okay, hello again. So our 13 local health departments, the Utah Department of Health, in collaboration with the Utah State Board of Education, has put together this great school manual that will help parents and teachers and schools get ideas for how to open safe and stay open throughout the school year. This has been a big effort on the Utah Department of Health public information team, specifically Jenny Johnson and Joelle Fierro, put a lot of time into putting this together and getting input from all of the stakeholders to make sure that it's accurate and useful for those who will be starting school in the fall. Part of this manual, we also describe what will happen in the public health response when a case is identified in a school. We recognize how important it is for kids to stay in school. It is essential, and we want to be able to have them stay in school in a safe environment. So to do this, any child who has COVID or has symptoms associated with COVID will be staying home. Those who are close contacts to a confirmed COVID case at school will have the option of having a modified quarantine. This means that they will be able to attend school if their parents would like them to, as long as they do not have any symptoms, they screen themselves for symptoms daily, they wear a face covering while in school, and practice physical distancing as much as possible. This will allow children to stay in the educational system, get the classroom setting that they need, while also keeping themselves and their environment safe. If any close contact starts to develop symptoms consistent with COVID, they will be asked to stay home. This is a process that we have been using for essential employees throughout this outbreak, and it has worked. So we know that this is a method that has been proven and can help kids stay in school while maintaining a safe environment. To be clear, though, this modified quarantine only applies to the classroom setting. So kids who have been a close contact to COVID, as long as they have no symptoms, can attend school and can attend classes, but they will be excluded from extracurricular activities, from sports. They're not going to be able to go to the movies or the mall. It's just for that essential classroom setting. And so for more details, we have Superintendent Dickson, who will provide more details on this.
Thank you, Dr. Dunn. I won't add much other than to say we are so appreciative of the state and local health departments who have been working throughout the summer and even into spring to meet with superintendents and charter directors to help them understand the ramifications on schools of some of these health conditions. The manual that Dr. Dunn described outlines many of the questions that we've been asked. And as stated, those are situations around quarantine, testing, safe conditions for teachers, what to do around activities and athletics, what a cluster looks like. And one of the things I love about the manual are the scenarios that are played out in the manual. So it can walk you through a day in the life of a student or a teacher who might have been exposed or a family member who might have been exposed. So it takes the health information and the guidance and puts it right into a very usable format. People might seem overwhelmed by 102 pages, but I can tell you that I read through it in just an hour last night. And I think it will be something that's so usable to our families. It's not just intended for school personnel, but for our parents and students as well, so they know exactly what to expect. And again, I just want to reiterate our gratitude for this manual. We know it will be a very helpful tool moving forward. Things change. The virus, certainly, we've learned more about it, and this is not something that we expect to not be expanded as new conditions arise. I am pretty certain that we'll be able to add to this manual. So it is digital, and I want to reiterate that it's on the coronavirus website, coronavirus.utah.gov. It will also be on our school resource site, the State Board of Education's coronavirus webpage as well. So this is in the hands of our superintendents and charter directors today. It's out to the public, and we encourage you to look through the manual and not just pick out one page that you might find on social media, but read it in its full entirety, and you'll see how it all plays out as a very helpful tool to our schools. Thank you.
Thank you, Superintendents. Thank you, Dr. Dunn. I want people to know that our education folks have been working literally around the clock to try to find plans and put them in place that strikes the appropriate balance to make sure we have an education system that functions where our young people can go and learn and be taught and protect their health at the same time, where parents can feel confident in sending their kids to school, as well as teachers and principals and our superintendents. It really has been a very significant team effort, and I can't thank them enough. I hope we appreciate our teachers. Our teachers, again, in cooperation with principals and superintendents and local school boards, have raised the educational achievement level in Utah in a dramatic way over these last 10 years. We've gone from kind of the middle of the pack till now with our NAEP scores, we're in top 10 in comparison to the successes of other states. Our graduation rates are up about 11 or 12%. Our minority scores are up. That's not been easy, but it's because of the good work of our teachers, in particular in the classroom, parents that are concerned and being involved, and the team effort of principals and superintendents working together. So I hope we appreciate the work that's been done in the past. I also hope we appreciate this is not an easy time. These are challenging times for our teachers, challenging time for us as we try to put together this education system. And it's not easy. It's not easy to do, but it's certainly something that's necessary. Teachers need to have some flexibility. And we know that there needs to be cooperation with all of us and probably a healthy dose of patience as we work together to get this underway. So thank you for your patience. Before I go to question and answer, let me just kind of an FYI. Most of you know General Jefferson Burton, our former Adjutant General, has taken on the role of being the director of our health department. His background of command and control and designation and deployment has been essential in helping the health department do all that they need to do in a more dramatic fashion in a challenging time than they've ever had in the past. General Burton's retired, but he has a real job where he works for our Department of Veterans and Military Affairs, and particularly working with the Payson Veterans Home. So his time with us is finished, and he'll leave tomorrow to go back to his employment in Payson. We appreciate his work that he's done there. And again, it's not been an easy job, and he's been an integral part of our unified command as they meet every day to review the data to help us decide what we should be doing and how we should be doing it and try to improve, which under his watch we've done. So he's had a great history of service, and that will continue. In his place, we're going to move Rich Saunders to that position. So he's already been there and been involved and helping out. So this transition will be very smooth without really any kind of a hiccup along the way, and should be a smooth transition. So we thank General Burton for his work, and we welcome Rich Saunders to take on that responsibility now, starting effectively really tomorrow. So with that, we thank everybody for what we're doing together. This really is one of those areas where we need to work together and set aside some of our political differences and find collaboration to find the solution. So with that, we'll open it up to Q&A, and we'll have everybody will be standing by. So what questions do you have?
Yes, Governor Rossrell with KUER. You set a goal of getting to about 500 average daily cases by August 1st, and that number has dropped down, but we're still above that. Are you pleased with where the state is currently at?
Well, I wish it was, below 400. It can always be better. I am pleased with the fact that people have, I think, in a spirit of collaboration, cooperation, and greater understanding of what they can do individually to slow the spread of the coronavirus, seems to be working. The fact we have a rolling average down to 508 today is good news. We're moving in the right direction. I'm not ready to spike the football and say that's good, or that's all. We still have a long ways to go to get this corralled and get to where we want to be. But I certainly am pleased for a lot of reasons that people really are working hard, I think. Some are a little late to the game, but hopefully they're going to join with us now shortly, particularly with the reports that have been given. I think we can be encouraged, but we ought not to be letting our guard down. We still need to do all we can to practice good protocol to slow the spread of this coronavirus.
Got it. And then I have a question for Dr. Dunn.
Go ahead.
Hey, Dr. Dunn, how's it going? On the Department of Health website, it says that the state has more than 300 long-term care facilities, but 311 have been impacted. Can you give a better sense of how many of these facilities are actually in the state, and to help us put that number, that 311, in better context?
Yeah, I don't have those numbers off the top of my head. We will certainly get that to you. I can tell you, though, that the numbers on the website are just the licensed long-term care facilities. There are other congregate living facilities throughout the state that have experienced outbreaks that we have been responding to as well. So we'll make sure we parse that out for you and get you more specific details on that. Sorry about that.
Got it. Thanks.
Next question.
Yes, this one's for Dr. Dunn. This is Carter Williams with KSL.com. You mentioned the declines outside of Salt Lake County and outside of Summit County. Those counties have attributed their decreases to mask policies. Is there anything, maybe, major businesses requiring masks that happened a couple weeks ago, possibly like test declines or just policies elsewhere that you're seeing that could explain why there's declines elsewhere in Utah?
Yeah, I mean, I think we know that mask policies in businesses certainly help the cause to decrease cases. That's definite. There's also probably some, spillover from, for example, a Salt Lake County mask order to Davis County or nearby jurisdictions. But these are all just kind of, correlations, not causation. Your point about testing is a good one. Over the past 3 or 4 days, we have seen, about 3,000 to 4,000 individuals being tested every day. Before that, we were in the kind of 6,000 to 8,000 range. So we have seen a drop off in our cases. Or in our tests. So that's why we need to be very cautiously optimistic about our drop in case counts. Our percent positivity has remained around 9.5%. So we aren't seeing huge surges, but it is something for us to keep our eye on, especially in this coming week as we finish out kind of that incubation period from Pioneer Day weekend. So cautiously optimistic about our lower case counts, but we do know that the face masks have had an impact and encourage individuals to continue making that decision for themselves to wear a face mask in public.
And a quick follow-up, we have seen a lot of other places in the world that have done a pretty good job managing. But this week we saw Hong Kong and Australia among those that seem to manage COVID really well up until now. And now they have new protocols this week. What does that say about how the department is preparing for, if there is this decline that's happening, how to continue that decline and how to manage it if it gets to a lower state?
Yeah, I think what's really important about those lessons learned is that we have to remember we're still in the middle of a pandemic with a novel virus. So it's impossible for us to predict how it's going to act. And so that's why it makes it ever more essential that we understand that we are going to be having these kind of lifestyle changes for at least another year in terms of really being vigilant about staying home when we're ill, wearing face masks in public, making sure we're using good hand hygiene. Those things are going to be really important for a while until we get through this and get a vaccine for COVID-19.
Thank you.
Hi, can you hear me?
Yes.
Thank you. My question, well, they're related. First of all, we just heard from Professor Abbott that the risk of asymptomatic spread is pretty high and that masks are not a silver bullet. So if students are allowed to go to school, even after direct contact with a confirmed case, just because they don't have symptoms, how is this not going to spread in the schools? And related to that, we are hearing a lot of concern over teacher retention. If teachers are forced to return to classrooms, even if they or someone in their household are in the high risk health group, especially once outbreaks start cropping up, how are Utah's school districts supposed to cope with the possibly higher rates of attrition? And not only would the most experienced teachers probably be the ones most likely driven away by the health risks because a lot of them are by definition high risk because of age, but most of the districts in Utah could end up competing with each other and nationally for an insufficient number of teachers, I guess, regardless of experience, not considering that. And then also, last week, Governor Herbert said the state's testing capacity was being overwhelmed, and as they're concerned that likely spread from reopening schools will overtax that capacity.
We'll ask Superintendent Dickson to come here and speak to those issues regarding the school. Let me just say, again, with emphasis, there's a number of tools in the toolbox to help us slow the spread of the coronavirus. Mask is one of the more significant ones, but there's many different things we should be doing and can be doing to help slow the spread. Some of it just takes a little bit of common sense and a willingness, in fact, to do something that may be a little bit inconvenient. But if we all do that with an attitude of we can work together on this and corral this coronavirus, it'll get better. If we say we don't care or nobody's going to make me wear a mask, no matter what happens, we'll have a longer time before we can get on top of the coronavirus. So hopefully everybody will have the right attitude of cooperation, knowing there's many tools in the toolbox. Masks are just one. But you've heard the protocol we've had before, being careful and don't go to work when you're sick, and hand hygiene, social distancing, and doing things outdoors is better than doing things indoors if you have the choice.
Well, I guess, Governor, my question is, how is this not going to spread in schools despite there being mask instruction in schools?
I'm sure there's no guarantee that it can't be spread in schools like it can be spread anyplace else. We have spread taking place now, and schools are not in session. We're trying to mitigate and minimize the risk by having our young people wear masks. Protocols are being put in place by Dr. Dunn along with Sid Dickson and our superintendent, and this COVID-19 school manual to give direction and guidance of how we can minimize the risk. If we do have a spread, there's protocol of what we do if in fact that happens, including closing down the classroom and maybe closing down the school. But we're not going to sit back in the corner and just wring our hands and say, well, I guess we can't do anything. We can do something. And we may be doing more distance learning than we'd like to as opposed to face-to-face, but we will find this out as we work together to find the solution. Sid?
Aaron, thank you for that question about teachers. They are essential infrastructure to our schools. We can't have an education system without them. They're our frontline workers, and we have to think about them every day as we plan. We have the opportunity to meet with our superintendents this morning, and they were sharing how they're working to support teachers. There are a variety of options that districts have been looking at and charters. For those who have high density of students in classrooms, there are online options, and they're making those options for teachers as well. I'll highlight Kane County, for example. They're using cameras in the classroom and microphones as a way to isolate teachers who can work in a setting that's safe for them, maybe in another classroom in the building and live stream. Students that are at high risk can stay home and see live stream instruction and interact with students in the classroom. So there are a lot of very creative ways based on health factors, but I want to go back to something that Governor Herbert said right at the beginning, and that is context matters. Our local leaders have been working with local health directors to try to mitigate risk and look at situations in every single school, in every district, and that's true with our charters as well, working with local health directors. I have confidence that none of our health directors would feel good about a plan that doesn't mitigate risk to the best of our ability. We know that the risk is there, and plans are taking into account all of those elements that can mitigate the risk. We've been training all of our educators, our leaders certainly, on the CDC's 7 elements, and distancing is definitely an issue. So looking at hybrid models, remote learning, and where that can't happen, or a local community feels like they have a level of risk that can adapt to more students in a class, they're putting other protocols in place. So looking at entry and exit, looking at movement and density, they're adjusting for recess, for lunch schedules. All of these elements are coming into play to make it safer for students and teachers. So it's not how we think of just returning back to a normal classroom. There are a lot of mitigation strategies that our schools are putting in place to help with safety for not only our students, but our educators, who are vitally important. So thank you, Aaron, for asking that question.
Thank you.
And just to follow up more specifically on quarantine and the public health response, Aaron. So the number one thing we can all do to make schools open safe and decrease the chance of outbreaks in schools is to decrease our community spread. So we can all take that individual responsibility to wear face masks, physical distance, stay home when we're ill, use good hand hygiene. Our local health departments are working closely with all the schools in their district, public, charter, private schools, to come up with these mitigation plans that fit the school setting and the community setting. However, we do have a standardized approach for case investigations and outbreaks. So for example, if we have 3 cases in one classroom, that whole classroom will be recommended to go virtual for 2 weeks, an incubation period. If we have 15 cases at one time, single school setting, or 10% of the school population is infected with COVID-19, whichever number is lower, the entire school will be recommended to go virtual for 2 weeks. And those 2 elements are there to stop the spread of COVID-19 within that school setting when we actually identify that spread is happening. That is if COVID happens to spread, despite the prevention measures that are being in place. You know, this is going to be a dynamic process moving forward. It's new for all of us. So we do remain open and flexible to changing our strategy as we learn more. So this is definitely a starting point for the local health departments and their schools to work together to try to figure out what's best for them.
Yeah, I just wanted to say during our review of the COVID literature, the most updated assessment of the risk of super spreading events through children is very low. So the disease appears not to be transferred as easily through children, and then there are many examples now of cases where that can't be transmitted back to adults. So please, there's a section in the report that has that summary and then links to the 2 studies which are updated about every 2 weeks. So I think it's really important also to have that scientific perspective that the risk may not be as large as we fear. Though again, we should always take the precautions we can.
We'll take 2 more questions.
Hi, Governor Herbert. I was wondering if you could give your reaction to President Trump has been questioning the validity of mail-in voting as we get closer to the election in November, and has most recently floated the idea of delaying the election because states aren't ready. What's your reaction?
Not understand what she's
the election and maybe.
Oh, the election? I'm not responsible for what comes out of Washington, D.C., so I don't think we need to postpone the election. Certainly, I can speak from a Utah perspective. We have great clerks in all of our 29 counties that run the elections. We have a great elections office here at the state that oversees that responsibility. We've seen no evidence of anything untoward with mail-in ballots. We think, in fact, it's been a blessing to a lot of people to be able to get the ballot, review the ballot, study the issues of the candidates, and make an informed decision. It's also, because people vote early, it's, I think, helped to tamp down negative campaigning. If you can't get the first vote, you want to get the second vote. And so I feel no reason to have postponing the elections, and certainly from a Utah perspective, I think that would be foolish. Next question. Yeah, last one.
Yes, Governor, this could be answered really by anybody. Could somebody explain again the modified quarantine, how that would actually function, and if there's any risk at all of spread of infection, why not just do what the Salt Lake City School District is mulling over and just pushing back the start of face-to-face learning one more semester and just stick with virtual learning for now?
Okay, Dr. Dunn, Superintendent, if you'd like to add.
Thanks, Paul. So I'll talk about the modified quarantine again. So our modified quarantine for schools is exactly what we've been using for essential workers throughout this pandemic. So we have experience with it. What that means is that if an individual is a close contact to a confirmed case, but they have no symptoms of COVID-19, they are allowed to go to school as long as they're checking for their symptoms twice daily, wearing a face covering throughout school, and doing as much physical distancing as possible. This allows them to still engage in that educational opportunity while still limiting spread of COVID-19 throughout the school. Everything we're doing right now is with some risk. So we're constantly weighing the risks and benefits. And in this case, it's, the benefits of kids being in school and getting that experience with the spread of COVID-19. And so, we're working to find that middle ground, and that's where we're starting from right now. What was your other question, Paul? Oh, so, there are a lot of different schools that thought about, the best time to start school. Some countries have actually started school earlier in some states, planning for an extended break in the fall when flu season hits. So I don't think there's any right answer right now because there's so much unknown. So we're working with each individual community and each individual school to figure out what's best for them. And then from a public health perspective, provide them all the guidance they need to start their school safe and then stay open throughout the school year. But again, we don't have, right answers or any one silver bullet right now, and just working with individual communities to make sure we're doing what's best for them.
think the one thing I would add to that, we as a state, as communities, have to address the issue of equity and broadband. And so while remote seems like a very safe option on the surface, people feel better about it if they're not in school, there are also issues at home of safety and conditions of safety. And one of those is having broadband access. We have to think of it as an essential utility, and not all of our families have access to broadband or to the tools that they need. And we're actually a state that's far ahead with our digital tools, being able to put a laptop or a tablet in the hand of every student, but then they get home and don't have the broadband to access that, especially if places that they're used to accessing Wi-Fi around the community are also closed. So it's the condition of the community, it's the condition of access and equity. We know social, emotional, and mental health issues are important, as Dr. Dunn addressed earlier. So thinking about ways to mitigate that with having contact with teachers, our students with disabilities, our students learning English. So we have to think about modifications as well. And while some physical distancing is safer, there are also other conditions that come into play. So those are the issues that our local boards of education, who are elected to make these decisions, really have to grapple with when they're deciding, do we go remote? Are we in a hybrid mode, a modified mode? So I appreciate the question, and that we have to take all of those things into account. And it's not just about our schools, it's a community issue. If we want our schools back, if we want our children back to schools, what are we all willing to do to get them there?
Again, we thank everybody for being here today, and we appreciate our participants. And as the superintendent was talking, it dawns on me that what we face today reminds me of a game called whack-a-mole. We're whacking the mole, and as we think we've solved one problem, it creates another problem, or it has an impact somewhere else, and we have to whack that mole, and that creates another issue. It is a constantly evolving and changing situation we face. The solution really is us using the best science we have, best advice we have, to find that balance point of making sure we protect people's health and their livelihoods at the same time. And they're not mutually exclusive, as we've always said. It does require us to work together. I am very optimistic about the trends and what we're doing. We're not perfect, but I like the numbers we have today, and we're moving in a good direction. It behooves all of us, rather, to make sure that we do our part to make that trend continue. As I've said from the very beginning, whatever plan we have in place will only be as effective as we ourselves as individuals do our part. So let's all do our part. Let's open up our schools as best we can. Let's get the education to our kids. Let's slow down the spread of coronavirus. Let's see what we can do, in fact, to get back to a new normal and the anticipation of a vaccine coming up here, hopefully, in the next 6 to 9 months. That's our best hope, I think, for long term. In the meantime, we need to work together. Thank you very much.
We'd like to thank Governor Herbert and excuse him and our other speakers. We also extend our appreciation to all of our interpreters, both in Spanish and American Sign Language. Thank you both. We will talk to you next week.